Many Germans donate to development agencies, but what actually happens to such donations? We are in Cambodia, one of the poorest countries in the world, where we are visiting some projects of Malteser International. Angkor Wat is a major tourist attraction and brings a certain degree of wealth to Siem Reap, Cambodia's fourth largest town. The old market offers a broad variety of goods, ranging from fruits and vegetables to different kinds of meat. Necessary alterations on clothes that you can buy in the market are done right away and for a good price by a lady sitting nearby. Pedicure or manicure, no problem. Everything is available at the market. Meanwhile, the new tourist hotels here are contributing to a comparatively high average income of $300 per month. Leaving Siem Reap on a pothole gravel road, we travel to a region without any tourism. The simple houses along the roadside immediately reveal poverty and the desperate need for development assistance. Finally, we reach Samrong, the capital of the Oda-Manche province, a small and dusty town of 3,000 people, hardly visible on the map. Here one also finds the office of Malteser International and its Cambodian partner organization SHRA, the Cambodian Health and Human Rights Alliance. Together they plan and implement health programs in the villages around. Asking the Malteser International Program Coordinator Vera Minnick about her experience, she answers, "I have an overall good impression of the cooperation on the provincial and the community level, and our partners are eager to collaborate."
Von der Zusammenarbeit auf Dorfebene.
One example for positive development is the provincial hospital. Thanks to the continuous support and training of medical staff since 1999, mother and child mortality rates have already been reduced considerably. Despite all the developments, we have to remember that the brutal era of the Civil War only ended a few years ago. The operating theater is a positive achievement for this region. In Europe, it would be a museum piece. This shows that further aid is necessary to support what has been achieved to date. The strong contrast of the Samrong market to the Siem Reap market shows the huge income gap between these two towns. Here, a family needs to manage all expenditures with an average of $50 per month. We are in a completely rural area and everything, even survival, depends on a good harvest. If there is not enough rain, like this year, people struggle to survive and look for answers through their prayers. During the regime of Khmer Rouge and the Civil War period, most Buddhist monks were displaced or even killed. Now they are back and lots of new pagodas have been built. The Buddhist religion is important for the Cambodian people, as it is not only part of their culture and tradition, but also helps them to keep up hope during the harsh times in their lives. To substantially improve people's lives, the support offered by international organizations is essential. Malteser International's help for self-help is crucial. Bad road conditions and the distances to the hospital make it important to establish structures at community level. Midwives and medical personnel at rural health centers receive continuous training and are thus enabled to look after their own community. In this healthcare center, 50 prenatal care visits and about 16 deliveries take place each month. To increase the number of deliveries in the healthcare center requires ongoing awareness raising and education provided by Malteser International. A patient on her experiences. I'm very satisfied with the medical services and the possibility to get medicines for my condition. Apart from physical examinations, health education plays a major role in reducing child and maternal mortality. Alcohol, cigarettes and lifting of heavy weights should be avoided during and after pregnancy. Nguyen, Malteser International's monitoring and evaluation officer, concerning the idea of health service delivery in remote rural areas. In order to improve quality of care and to attract more women for health center deliveries, Malteser International is involved in on-the-job training of health center midwives and traditional birth attendants. Mother support groups in the villages play an important role for health education and improvement of nutrition.
We call TBA traditional birth attendants, and then we have a mother support group. Mother support group is the volunteer working in the community, try to promote the mother and child health. Yeah.
This activity is also supported by the partner organization SHRA, which organizes meetings on health promotion in the villages. The meetings are attended intensively and with great interest.
Of course, the first we try to find what the problem that they raise by themselves, and they try to ask what
First, we try together with the community to analyze their problems. Afterwards, we look for solutions to improve the situation. This is a task we have to do together. SHRA will give some material to the villages, but they have to invest as well and do the work.
That they will need in their catchment area, in the villages.
The lack of hygiene is a serious problem. Therefore, sanitation is top of the agenda. Chickens and ducks should be kept in clean shelters. The villagers now also pay attention to clean fodder for their animals. Pots and plates are cleaned with clean water and kept in food cabinets to help prevent diseases like diarrhea. After the outreach activity, we are heading back to Samrong, passing a rice mill and rice fields, which dominate the landscape in the province. Now we are meeting a delegation of Malteser International board members together with a representative of the German Federal Ministry for Economic Cooperation and Development, who are getting information directly from the head of the provincial health department.